Hi there, it's great to see you again. Please do take a seat. So how have you been since our last session? Oh, great. Okay, that's good to hear. Of course, last week we discussed many techniques. Have you managed to incorporate any of them into your daily routine? That's great. I'll make a note of that. And overall, how have you felt in terms of your anxiety levels? As I recall, last session you did say to me that your anxiety does creep up to an 8 out of 10 on the scale. How's it been this week? Okay, about a 6. So we're going in the right direction then. Yes. Yes, of course, I'll log that down. Can you tell me more about what's happened this week and how the techniques that we introduced have actually helped you? Okay. Okay, that's good to know. Let me just make a note of that. And can you describe any moments within the last week when you did feel anxiety and how you combated that? Great. Yeah, I mean, this is our second session and you're already making great progress. It's honestly incredible. Of course, I can't delve into too much with all the patient confidentiality, but I can assure you that it is quite rare to see such progress in just one session. So you are doing an incredible job of trying to manage your emotions, for sure. So we also mentioned in the last session that you was trying to find long-term goals, because that was something you were struggling with. You were struggling to plan your career, I remember you saying, as well as your financial situation. Have you been able to strategize a plan, or maybe just get some form of semblance around everything? Okay, right, well, like I say, it's been a week. That's something after this session I think you should think more about, because of course thinking longer term is always important, because it is the long term which matters the most. Of course we want to get your symptoms under control in the short term, but for you to manage them effectively moving forwards into the next few months and years, you need to be making goals, plans, and just setting realistic expectations for yourself and where you want to be in your life. That's very, very important. Okay? Great. Yeah, I'd love to hear your thoughts on the breathing techniques in particular. How many times a day have you been actually carrying through with them? Great. Yeah, that I would recommend. That would be the place to start, averaging around 2 to 3 times a day when you do feel your symptoms creeping up. Yes, so well done. I'll make a note of that as well. We also mentioned having self-care evenings, just taking 1 or 2 hours out of your busy schedule and just setting that time aside to focus on yourself and maintaining that sense of presence within the moment. So, did you manage to actually incorporate any self-care evenings? Oh, that's good to know. Yeah, I would recommend, yeah, doing that if you can every night. I know, of course, we can't always fit in that 1 or 2 hours every day to focus on ourselves, but if you can make it a regular occurrence, then of course it's going to have an impact just on your overall mental clarity and just your feeling of self-worth as well. That's something that we forget about a lot as we get older. I know you are in your 30s now, and of course you're focusing on juggling all aspects of your life, but sometimes when we do that, we truly do forget about ourselves. So taking that moment, even if it's just 15 minutes a day, just to reaffirm and practice self-care. We need to make sure that this is in our routine constantly, just knowing that we are worth everything in life. So you did mention skincare is one of your hobbies, and that's something that you've been able to carry out on a nightly basis, so that's good. Sometimes it is really relaxing to light a candle, take a deep breath, and obviously all those breathing exercises we mentioned into consideration whilst carrying out the skincare, because doing that at the same time can be an extra boost to reduce your overall anxiety symptoms. Great. And okay, yeah, sure, go. Nice. And how have they found it as well? Great. I always recommend my patients to share what works for them with other people if it truly is helping. So it's great that you've, let your colleague know about that technique in particular, and I'm glad to hear that it's helping them as well. Truly, people do forget just the basics, and it's so easy because I was in that position myself. Every patient I see just about is in the same scenario, and it's very, very difficult sometimes to just pick yourself up, give yourself the love you need, and just focus on the positivity. Have you tried doing grounding techniques? Because I know we briefly mentioned that last time. Okay. Well, there's the 5, 4, 3, 2, 1 technique. Basically, you identify 5 things that you can see, 4 things that you can feel, 3 things you can hear, 2 things you can smell, and 1 thing you can taste. This has been clinically proven to reduce anxiety and help manage panic attacks and improve concentration. So that would be my next little bit of homework for you to do. Let's call it homework in the next week. If you can help, I guess, just get yourself grounded in the moment and just take that deep breath, and then, like I say, focus on the 5, 4, 3, 2, 1 technique, and just realize that you are present right now in this moment, that nothing else matters. Okay? Great. Yeah. Yeah, of course, there's some other techniques I can discuss with you. I would prefer it, and I think it's probably beneficial if we focus on 1 a week, because that gives us something to, of course, discuss in the next session, and that way we can kind of open the conversation up to talk about what has been working and what hasn't been working, because it's very important to identify what doesn't work as well as what does work, because we need to make sure that we can get you up on multiple techniques that are working specifically for you, because everyone is an individual. Of course, many people deal with similar symptoms, but the way that we manage them can be worlds apart, seriously. That's very important. But there is, of course, sleep hygiene techniques, which honestly you should incorporate even if you didn't have anxiety or depression or any form of mental health issues. Sleep hygiene is incredibly important for your physical health as well as your mental health, so we can talk through that if you want to as well. Okay, great. So yeah, sleep hygiene basically is improving your environment of where you sleep and how you sleep and when you sleep. So yeah, just remember that. So yes, of course, try and be consistent with your sleep schedule. I know it's easier said than done, but it's really great to pair, especially with the self-care evenings, knowing that you've done your evening skincare routine and then you're ready to go to bed and relax for a full 8 to 9 hours. I'd recommend trying to get 8 hours minimum, because that is what's recommended. And of course, having that sleep and just feeling the energy in the morning in comparison to only having 5 hours sleep, like you mentioned that you only have sometimes. So you will feel the difference for sure. It will improve your overall mental clarity, and like I said, the physical benefits as well are truly beneficial. I mean, you can pretty much do anything on 8 to 9 hours of sleep that you might not be able to do on only 5 hours. Okay, so yeah. And I know that you mentioned with one of your previous therapists that you did journaling, is that correct? Yeah, I thought so. I have it written down here on my notes. So you said that you did do that a few years ago, and that was something which did help, and that you were planning on trying to incorporate into your daily routine moving forwards. Is that correct? Great. And did you do that last week? Okay, that's fine. Yeah, no, like I said, we're doing baby steps, and we're incorporating the new techniques that you've not heard of before. And of course, when something's shining new, it's really easy to stick to it, especially if it's having beneficial results. It's trying to stick to it, like I said before, long term, which is going to have the most benefits. So, yeah, with journaling, because you said that you managed to do journaling pretty much every day for 2 years at one point, I feel like this could be a really good step forwards for you. If you could try, maybe do it at least, start off with just 2 days next week, just a little bit of journaling. Write down your thoughts and feelings regularly. When you're feeling anxiety, write it down. When you're feeling stressed, write it down. When you're feeling happy, write it down, because that will help you identify your triggers. Because I know sometimes you said you feel anxiety for no real reason, or you can't identify a reason, and of course that can happen, but 9 times out of 10 there is a little trigger, whether it be the weather, whether it be, like I said, a bad night's sleep, whether it be a stressful journey to work. Just these little micro hassles in our life can really trigger anxiety. So if you feel anxiety, you should journal, write down when you felt it, and identify anything in the past half an hour that could have triggered the symptoms. Because oftentimes throughout the day, as you know, you said your anxiety comes in waves, and it's easy to forget the triggers during the second wave or the third wave throughout the day. You will forget the triggers from the first initial anxiety. So you need to make sure when you do face the symptoms of restlessness and distress that you write it down. Great. Yeah, of course, it will help process your emotions, and you know, it like I said, it will help you identify the patterns, the triggers. Sometimes it is to do with the weather. I know we're moving into the autumn at the moment, so of course there's going to be a lot of the population that are going to be suffering with seasonal affective disorder due to the change of the temperature and the shorter days. So, I mean, has that been something that you've ever thought about in the past, potentially triggering your anxiety symptoms? Okay, right, yeah, so potentially that could be one of your triggers. And if you journal next week and you notice with the days getting shorter that your symptoms are getting worse, then that will help us in the next session to try and find techniques to combat the anxiety that you're facing due to the weather and the changing seasons. Great, yeah, of course. There are techniques to help overcome that, but of course we need to journal to know if that is truly a trigger for you, because it may not be. So yes, just keep a track of things. Yeah, of course. There are self-compassion exercises that you could carry out to try and combat those negative feelings that you're dealing with in terms of low self-image, and just overall low confidence that you've mentioned, that can often be a trigger for mental health, and sometimes a symptom of mental health as well. Sometimes it's a chicken and egg situation. So working out which one is triggering which one is key. Yes. Definitely. Of course, with the rise of social media in the past couple of decades, we've seen body image issues go through the roof. And I know you're a person in your 30s and you're struggling, and it's difficult when you see all the filtered pictures. There's been research into this. There's lots of studies ongoing at the moment trying to identify how much of an impact social media has on our mental health, our body image, and our overall sense of worth. So it's definitely key to practice self-compassion exercises, just affirming that you are worth it and that you are a beautiful person no matter what you look like. True beauty comes from within. That's something that we need to remember. It's something we often forget about, and how could we not forget about it when we're bombarded every single day with unrealistic images, and you get the drill. Yeah, it's difficult. And of course, before social media and magazines, it's been going on for a long time, and I think everyone is just getting jaded from it, and it does pile up on top of you at the end of the day and make you feel even worse than you already did before. No, I totally get it. There's definitely legislation hopefully going to be put in place, because I don't see how we can manage all of the self-destruction that we are causing to ourselves if we don't get a handle on it. But that's for another day. Yes, so anytime you get a negative thought about yourself, just remember you are beautiful, you are worth it, and you will get through this. That is key. That is the most important thing, knowing that you belong just as much as anyone else on this planet. And just remember that, because if you don't, it's very, very easy to slip into a negative thought process and pattern, and I've seen it too many times. So yes, practicing self-compassion along with the self-care evenings definitely would be the next steps. Okay, so yes, is there anything else you would like to discuss? Perfect. Well, I hope that you go away from this session hopefully feeling a little bit more reassured that there are definitely more things we can do to help manage your symptoms. But honestly, like I said at the beginning of the session, I am very, very impressed genuinely with the progress that you have made of the past week. Honestly, it's astounding, and I look forward to seeing you next week, and we will definitely discuss other techniques. And yeah, I wish you the best, and I'll see you next week. Great. Bye.